Protocol observed, Mr. Rector, sir, distinguished colleagues. We have a few information to give from the Research Center. And the information is compiled not just by me, but principally by Dr. Shirat and Ms. Rao. But we work as a team. I will try to use the outline here. The management, the registration of projects, publications, the established role of the Research Center in AEEDC, the contribution of the Research Center to the NCAA preparation, research groups, and research mentoring. And I will end with the specific plans which we have discussed in the center for next year. Electronic management has improved. As you know, there's always issues and there are people complaining, I couldn't register. I called Ms. Akanshar, there's no answer and all that. But we are happy to tell you that the registration online is like 99.9% perfect now. We also have online compliance with the Institutional Review Board's checklist. That is the old Ethics Research Committee. We now call it IRB, in line with what most institutions are using. And to facilitate approval, we have research categories 1, 2, and 3. For categories 1 and 2, I, or Dr. Pani, or Dr. Jamal, who is the chairman of the IRB committee, can executively approve and then proceed to the IRB approval. Category 3, which is clinical trials, will require a committee meeting to look at the proposal by the student or the staff. And then we have this new thing which was spearheaded by Dr. Pani, which is a good thing for our college, both as an announcement to the world that we are keeping in touch with what other people are doing. In the kingdom, as you may know, King Faisal Hospital, the National Guard, and I think the military, they have registration with the Clinical Trial Center at NIH, Bethesda, Maryland, and we now have, our college is registered for clinical trials. Registration is a strong encouragement. It's not like it's a law as such, but we encourage anybody, any group doing clinical research to register with the clinical trial registry in USA. Right now, I think we have 4, and I think the 5th one is Dr. Nancy Ajwa. I think she just got registered last week. So to continue with the digitalization, the website was completely redesigned with the help of Mr. Arwin and Ms. Akansha. The checklists are now available for the faculty, students, and interns to prevent delays in approval. We apologize to those of you who felt that your approval was delayed. You have to recontact the research center and so on. But I think it's fair to say now that the approval process, the registration process, they are reasonably efficient now. When you deal with computers, electronic things, you can always have glitches. But by and large, I think we are doing reasonably well. The checklists for Institutional Review Board are available, the college website. So visit it, even if you have nothing to do, check it out. So that when you do have something to do, it's easier for you to use it. That is the site. About the interns research projects, Of course, there's an internship committee that looks at all these details, but because they are registered in the research center, we thought we would let you see what the data are. And it's encouraging that 4 of the intern research outcomes are already published. We always say that doing a research and not publishing it is incomplete job. So we're happy that some of the interns have been able to publish their data. There's a checklist. You don't have to go through the details. It's in the website. This is to facilitate approval, not to delay it. For laboratory and clinical studies, we have some guidelines. Maybe we are not announcing these things adequately, but now with the website, you are free to check all these things there. The last paragraph there about clinical studies and trials involves any intervention, injection, trial of a new prosthesis, or whatever, intervention, we think should be normally handled by a staff, a faculty staff. The students don't have enough time for any meaningful clinical trial. Therefore, we discourage undergraduate students from engaging or trying to engage in clinical trials unless it's part of a faculty trial. So, all students must be registered as faculty research projects. All such studies, in addition to registering with the Clinical Trial Center at NIH. That's the protocol for clinical studies. All clinical trials must be registered with the Clinical Trial Registry, and we're happy we are part of that now. It also puts our college in a good international position. And that's it. We figure that to be associated with the clinical trial, it's okay. We are not yet into large-scale clinical trials because the protocol is rigorous. But we have started. If more clinical staff, faculty staff, want to engage now in clinical trials, I think it's time to do it. And interestingly, our staff have been increasingly linked with NIH grants originating from other centers. But there's no reason why, if we work as a group, we cannot initiate grants from this center, from this institution, both for CAST, for wherever, or for NIH, or with groups in National Guard, groups at Pfizer, and so on. From what the rector has been telling us, we are getting more and more preeminent as a private institution. It's not easy for private institutions to get preeminent. But I think in the short life of this college, we're doing pretty good. There are problems here and there, but by and large, we're doing well. And so we like to encourage our staff to continue to be linked with outside sources that are already granted research grants from USA or from UK. This is the clinical trial in the US. You can see there, Dr. Pani has a number there, and Dr. Ajwa also. Now, publications from Riyadh colleges. This is an update. There's been a number of mixed design studies done in Riyadh colleges. And you can see here, surveys predominate with some clinical studies. Clinical studies, of course, different from clinical trials. I know you know that. But clinical, they're all important in health research. That's what we teach our students. Some people personally feel that only hypothesis-driven research are important. Yes, they are important. But for human health, There are many other things that are important. Surveys, clinical studies, epidemiological studies, heuristic studies, if you will, all kinds. Methodological study, try new instrument, new devices. So this is what we have here, the mix we have, as you can see. But this is because the bias here, the blue, is because these are mostly students, dental students in L12, who, within a space of only 8 to 10 weeks, they have to complete their research. So they tend to do surveys. But some of them go beyond that. So we do not and will not discourage surveys. But we hope the staff can encourage the students to do other types of design. These are the publications. We should be proud of that. It's getting bigger and bigger every year. And we hope that it continues to get big. Anytime I listen to the rector talk about publication in high impact journals, I agree with him totally, but I also have a feeling that there are many journals that do not have high impact factors that we can publish in. The journals in Saudi Arabia today, medical and dental, all of them have low impact factors, but they are serving the community. So without prejudice to aspiring to publish in high impact factors, I think for the community, we can publish in our own journals as relevance, as meaning to the community. And these are the pie chart here. And because of the nature, the constitution of the school, we do expect the dental publications to be more. Single and multi-departmental cooperation, you can see here, it's improving. We like it. We like multi-departmental, multi-disciplinary research. It's not easy. People who at times don't get along, but in research culture, one of the things we want to do is to be able to work with people we don't even personally like. It's easy if you like the person you're working with, but you have to do research with the person you don't personally like. Please try and do it. Research Center and the AEDC. Well, officially in the last 3 years, we, myself and Dr. Pani, we have represented the college and presented papers at all the meetings in Dubai. We went there officially as representative of the college, and I think we are well received there. This year, we presented 2 papers there, not poster. We presented it as 45-minute presentations, as you can see here, trying to promote the culture of research in undergraduate studies for preventive purposes. And of course, the role of systematic review and meta-analysis, the lesson from high-caries population, which is part of our remit. As you know, the Research Center is officially designated by the GCC Council of Health Ministers, Chief Dental Officers, to coordinate the strategic plans for bringing down caries in the Gulf. It's an honor that we are so designated, and that is why we go there every year to participate. You can see here from 2014, 2015, and 2016. NCAA. Well, the whole staff of Riyadh colleges worked very hard, as Dean Saleh said. But we in the center, I think we also worked diligently harder, maybe, on the 5-year strategic plan for the college. Very detailed, and we hope and expect that most of these plans will become implementable. About next year, this is what we should have been doing more often, to conduct workshops oversighted by the research center for staff, for students, for outsiders. But I know our timetable, our schedule is pretty tight, no question about that. But we had a little discussion in the research center, and we're going to propose to the administration to have a number of things incorporated into the agenda for next year, academic activity. We want to do SPSS in scientific research data management, have a workshop on it, hands-on with your computers and so on. We want to talk about group research grant application. It looks easy, it's not. Those of you who have tried to fill the CAXT form, you know how thick it is. It requires cooperation. We will have a workshop or symposium on it. Scientific research writing and referencing software. Some people have problem writing. They have their research data, but to connect their data in a comprehensive, easy to understand scientific communication format, it's not always easy. We will discuss that. We want to. And then, of course, the systematic review and the meta-analysis, which these days, the mantra of medicine and dentistry, which is the highest evidence that we could have in dental care or medical care. So we're going to have a symposium on that. And then, of course, we want to talk about research and publication ethics. Plagiarism. Plagiarism. We hope we have an open discussion about it next year. Faculty research groups, I am not happy to report that the faculty research groups are underutilized. We send the list to all the students in 10, 11, and level 12. They have the list of the faculty groups. It appears the students and interns are not aggressively contacting the chairman of the groups. That was my letter to them, that they should go and talk to the chairman of the groups to let them know what they are doing and to ask for guidance. That is not as good as we want it, but I hope we can improve on that. The next point is the appeal to faculty staff to avoid having a unmanageable number of supervision. You have your clinical duty, you have your research of your own, and then you are mentoring. There's nothing wrong with that. We want it. If you don't do it, we won't have anything. But I think the students get the impression that they should be going to particular people and all that. Well, maybe we thank those faculty staff, but please be honest enough to tell them that I have one or two. I cannot take you on. Go and talk to other faculty members. There's no point with the number of faculty staff we have to have one person doing 4, 5 student research. It's possible, but it's not advisable. So if you lower the number of your supervision, you have more time to supervise, to talk, and to actually interact with your students. I think that's the last slide. I thank you, Mr. Rector.